Tonight at 6, Colorado tries to figure out how to get kids back in the classroom safely.
I think we're all nervous.
Aurora makes testing a priority and pushes back the first day. Denver admits it might have to do the same.
The only constant is change right now.
Plus, we know kids are less likely to get seriously ill from COVID, but how bad are they for spreading it?
If Susie has a fever, I'm assuming it's going to be COVID until proven otherwise.
We are experiencing very high call volume. Please try your call again later.
And Denver7 learns thousands of calls are going unanswered at Colorado's unemployment offices.
Some have been waiting for months to get their first check.
It's a wall. You hit that wall as hard as a car accident.
Since March, we've been telling people to avoid large crowds and stay at home when possible. In a little more than a month, school districts are going to ask hundreds of thousands of children and their teachers to do just the opposite.
It's not like administrators are going into this with their eyes closed. They are thinking about parents who can't afford a semester of the kids at home, and they want students to get a complete education. And they've put together plans and contingencies.
COVID, however, doesn't care about our plans. And today, Denver schools announced the district might need to push back the start of the semester by a week. And with that, Denver7's MEGHAN Lopez begins tonight's 360 coverage of class in the time of coronavirus. Megan?
Yeah, and what that looks like is making plans and then having those plans change and then having them change again. DPS says that it is trying to remain flexible, but every couple of weeks, really, something else comes up, whether it's another wrinkle, another question that they are just trying to work through. And all the while, parents and teachers say they just want to have a say in this discussion.
We're wrestling with lots of different issues.
If it feels like the Denver Public Schools plan to resume class is changing every week, that's because it is.
Including health screenings.
After announcing its strategy to reopen last month, on Wednesday, a shift thanks to COVID-19.
The only constant is change right now.
The district is now considering opening on August 24th since a third of its buildings don't have AC and breathing in a mask is difficult enough.
We know the end of August can be hot. And we always are monitoring that.
And instead of having everyone start on the same day, they're considering a phased-in approach.
Kids have time in smaller groups to be able to learn the protocols, work through that, and see, how things are going to adjust.
Before that can happen, though, they've got to get staff on board.
We've actually heard quite a bit of concern from our teachers.
DPS is in talks with the Denver Classroom Teachers Association about reopening safely, but DTCA still has a lot of questions.
Will we have enough substitute? Will we actually be able to socially distance? How are you going to get the schedules to work right?
They're also concerned about PPEs and testing. Their bottom line:
if we're going back, we really just need to have confidence that this is the right way to go and it's as safe as we can possibly make it.
There's a lot of fear, there's a lot of anxiety, there's a lot of stress.
Parents are also asking for more involvement in the discussions. Liz Stolniker started a Change.org petition after talking with other parents, and within 24 hours, thousands of signatures.
It's clearly struck a nerve. We can all look at each other and not feel alone in these concerns, that it was a way of articulating something that was in the air.
The district has sent out surveys, but Liz says that's not enough. She wants to support their reopening.
What we're asking DPS to do is to have our backs and have our teachers' backs and our students' backs.
So she's calling for more transparency, equity, and parent involvement. With a little more than a month until school is set to resume, there's still a lot of uncertainty, a lot of questions and details to still work out. But the one thing that is clear is
this year is going to be different.
So DPS is hoping to announce its finalized plans sometime next week after it meets with the teachers union and talks through some of those questions. We also might get a first look inside some of those schools and classrooms to see some of the health and safety changes that were made. But take a deep breath, guys, and don't get too attached to anything because, like my story said, all of this is subject to change again. I'm live. MEGHAN Lopez, Denver7.
Yeah, it's definitely complicated. Thank you, Megan. Now, Aurora will push back the start of school by a week. Kindergarten and preschool will begin on the 24th, everyone else on the 18th. Aurora also announced today it will be able to test teachers for COVID every 2 weeks. The district promises results will be processed quickly.
And no child under the age of 10 has died from the virus in Colorado. How effective they are at spreading it, though, that's what's still being studied. Denver7's Jason Grenauer with that, and what children lose by not being in class.
So far, we've had 0.
But the lack of a positive COVID case at Lori Phipp's pediatric office doesn't mean she's not concerned for students returning to class this fall.
Can children get sick? Absolutely. I I think they're less at risk than some of the other populations.
That's why she believes it's okay for schools to open with masks, hand washing, social distancing, and other precautions.
The risk of their mental health and well-being, which is also very important for pediatricians. Like I said, I think we kind of owe it to find a safe way for them to go back.
But as a healthcare provider, she still has questions, especially when spikes in colds, flu, strep throat, and other viruses usually increase every fall anyway.
If Susie has a fever, I'm assuming it's going to be COVID until proven otherwise. So then we have to get her out, get her tested. Do we close the classroom? Is that teacher quarantined? Is the class quarantined?
But I think the answer is not one size fits all.
Dr. Reginald Washington is the chief medical officer for the Rocky Mountain Hospital for Children.
We've had a couple of deaths, so we really respect how bad COVID can become.
He's also kept his eye on the data, showing children who are infected with the virus are less symptomatic and less contagious than adults, though they can be asymptomatic carriers of the virus.
That leads some experts to say it's safer for younger kids to go back to school, preschool and that age group, maybe kindergarten through 6th or 7th grade, as opposed to high school students.
But he warns districts should be flexible, ready to cancel class or even not open altogether if a spike happens.
If there's a very large increase in COVID cases in a particular community, it's probably not a good idea to go to school.
In Denver, I'm Jason Grenauer, Denver 7.
Denver's rebound is on hold. Mayor Michael Hancock says the rise in cases leaves him no choice but to halt any new reopening plans.
Frankly, it's better to take small steps forward and even pause moving forward in order to avoid having to fall back or lose ground.
The mayor's decision means he will not be hearing any variance requests for businesses that would like to reopen ahead of schedule.
And add strip clubs to the list of places experiencing COVID outbreaks. Both the Players Club and Shotgun Willie's are reporting cases among staff. Customers seem to be in the clear for now. Douglas County right now is holding a town hall over its decision to part ways with Tri-County Health. Commissioners decided the health department's mask mandate was enough reason for them to split and form their own agency. And this despite the fact that Douglas County has just chosen to opt out of that requirement. So beginning next week, masks are going to be required for all King Soopers and City Market customers. Same rules now apply at Walmart and Sam's Club.
And Colorado hospitals staying in good, if not great shape tonight. 368 beds are in use right now for patients confirmed or suspected to have coronavirus. That's down 10 from yesterday. 318 ventilators are in use. The state has 1,100. Now, cases are still higher than we'd like. Another 469 people tested positive today, and 7 more people have died from COVID-19. Attempts to track COVID through contact tracing are running into some hurdles. Apparently, a lot of people assume that when the phone rings and it's from an unknown caller that it's a scam artist, and they just don't pick up.
And then making matters more complicated, sometimes a person actually is a scammer.
They come across as coming from a local county health department, which they can easily Google some names and some phone numbers. So to the average person, it looks like a legitimate call coming in. The person actually sounds legitimate.
Public health workers are never going to pressure you. Keep that in mind. They're also not going to get offended if you ask them some questions and make sure they say who they are. Now, all they want to know is where you've been and who you've been around in the days before you got sick.
Still no word on the cause of a fire that left 2 people and several animals dead in Arvada. The home on 71st near Sims was already engulfed in flames with billowing smoke by the time firefighters arrived overnight. We spoke with a neighbor who ran in to help.
I told my daughter to call the 911, and as she was doing that, I ran back in and got some clothes on. I ran across the street. Me and my neighbor Jason down here, we ran across the street, kicked the door in, and broke the window out of the house trying to retrieve the occupants inside. We got the little girl out, and she's like 7 or 8 years old, and I mean, she was coughing up black soot out of her mouth and everything, and we tried to get her dad after we got her out.
3 others, several additional animals were rescued. The names of the victims right now have not been released.
The man known as the REHAB mogul has just been sentenced to 52 years in prison And Denver7 has been following Chris Batham's case for some time now. Both a financial and sexual predator, he assaulted at least 7 women and ran a $175 million health care billing scam out of sober living homes in Colorado and in California. Cliff Brodsky, an investor, testified at his trial.
It's incredible. Just history was made today. I mean, a predator was taken off the streets for life who would have harmed so many people. He was kidnapping and drugging, raping lots of girls. And they were coming to me for help, and I had no idea. I was just an investor who got scammed. I didn't know he was doing all that other stuff.
Now, Batham was convicted of getting multiple insurance policies for clients and fraudulently billing those clients and their insurance companies. The case raised questions about whether Colorado needs to better regulate the drug treatment industry.
A Boulder man will spend a month in jail for stealing $50,000 worth of ski equipment. Prosecutors say Jason Kawaguchi admitted to staking out the ski racks at A Basin and Eldora. He ended up with 74 pairs of skis, 42 pairs of poles.